My name is Albertina Nyatsi. I come from Swaziland and I live in the capital city, which is Mbabane. I am the national coordinator of an organization for women living with HIV, which is called Positive Women Together in Action. In 1997, I felt sick and then I went to the hospital. I was coughing and then they gave me medication and I took it for a long time, but I didn't get better. And then because instead of getting better, I was getting more thinner and the cough continues and I was coughing more than when I started treatment. So I decided to cross the border and go to South Africa. That was when I was diagnosed as having TB. And that is when I discovered that I was HIV positive. We've lost lots of women through TB, but just maybe because we didn't know much about TB, we never thought it was TB. So now, when I look back, I feel like had we maybe been told, we would have known that this is TB and made sure that we advised them maybe to get tested for TB. Women are more vulnerable to TB and HIV. Firstly, in Swaziland, we are a people that loves their culture and our tradition. So when you find that sometimes it doesn't favor women, we have what we call the minority status of women, where you find that women, maybe they're treated as children. You might decide that I want to go to hospital this morning, but when you tell your husband, he cannot agree and he can say you will go to the hospital next week. The diagnosis doesn't take one day. You go to the hospital to fetch the sputum bottles, and then you come back and spit for 2 days, and then you send them back to the hospital, and then you come back again. They tell you a date when you are going to come and fetch your results. So at the end of it all, you find that they may stop going because they don't have money. Some people die while they're still waiting for their results. Taking TB medication is so difficult. I remember when I was taking my own medication, I had to drink something like 14 or 15 tablets at the same time because it was my TB medication, some vitamins and other things. I remember that I would feel like maybe I should just wait for today so that I let the medication go down the throat. That is when most people then develop drug-resistant TB, because if you miss a dose, then it means that it becomes resistant to the medication. Women and children are more vulnerable to TB. If someone is sick with TB in the home, it's the woman that is supposed to be taking care of the sick person. And if the woman is not there, it is the girl child that is supposed to take care of this person who is sick. And then sometimes in the event of a death where we find that most parents die, the children are now left to fend for themselves because the parents are now gone. So in most cases, you find that there is going to be no food. The girl child is supposed to ensure that before they sleep, they have to eat. So that is why we then have maybe girl children being vulnerable to sleeping with people or to sleeping with men, because they are going to be able to provide some form of transport so that the other small children are going to be able to go to school. When I tested in 1997, I was tested for HIV. I was found to be HIV positive. This is what we call TB HIV coinfection. When you have HIV, your immune system becomes low, and then TB takes advantage of a low immune system. In our support group, we found that in a group of 45 women, we find that 40 had either had TB or were currently having TB. The Global Fund to fight TB and malaria is a major funder for most of the activities in Swaziland. Most of the TB medication and malaria medication is bought from the Global Fund. So it is a fund that has helped make a difference in our lives as a country and as people living with HIV, TB and malaria.